This is the start of the season, not the end. It's a conversation we want to have with people. If people have got ideas, suggestions or whatever, the basic facts are in the guide we've got there, not the detailed things I said. Those can be found on the website. Anything else that you don't have, if you contact the cabinet member responsible and they clearly identified on there, or myself or communications department, will endeavour to get the information back to you. If at the end of the proceedings Nick's doing one-to-one and group sessions, I'm doing individuals coming in to meet with me on request. If you want a one-on-one meeting with any of the cabinet, please just contact my office and Judy Hurst will arrange it at times that's convenient to all. Right, with that, can I hand over to Steve Harker, who will give the kind of overview of where we're at?
Thanks, Bill. As Bill said, my name's Steve Harker. One of my responsibilities as a cabinet member is have oversight of the council's budget as a whole. What I wanted to do first is two things really. Firstly, to give you an overview of the entire budget in terms of how much money we don't have anymore and why we're in the financial situation we are presently. And secondly, just to give you an overview about how the budget proposals that are with us today, how the cabinet went about creating those proposals, because we're in a very different place in terms of the budget we have than we were 5 or 6 years ago. So firstly, the financial challenges that we're facing. When the coalition government came to power in 2010, one of the things that's happened since then is local authorities, it's not just this local authorities up and down the country have had large amounts of money taken away from them in terms of government grants that local authorities get to help fund the things that local authorities do. So for Darlington, what that has meant is that since 2010, our revenue budget, we've lost £33 million annually. And to put that into context, our revenue budget next year is approximately £87 million. So in terms of real money in real terms that we've lost from government grants already, it's about 38% of our revenue budget next year. So if take away one thing this evening, is the fact that we have lost, in terms of grants, a huge proportion of our budget. And that's the issue that we're facing today in terms of having to make further cuts. It's not the first time that we've had to make huge savings. We've been having to do this over a period of 5 years, and it's continuing over the next 5 years. The estimates that we're making at the moment is in the next 5-year period, we need to make further cuts of around £10 million. So it means in a 10-year period from 2010 through to 2020, in real terms of in money today, we will have lost from our revenue budget, the money that we get each year to spend on all services that we need to provide, about £44 million. So don't make any mistake about it, we have had a huge amount of money cut from the money that we use to provide services to residents in Darlington. The second thing I should stress is there's also been a subtle change in where the money comes from, and also effectively how much money we have. You'd expect as an organisation, if we were doing the same things we were in 2010 and 2020, that our money that we needed to provide those services would increase slightly to cover effectively inflation over that 10-year period. Because even if you did the same thing cost-wise, simply because of inflation, salary costs, cost of buying care, etc. So over a 10-year period, you'd expect, if nothing else changed, the money that we need to provide those services should rise just because of inflation, whatever it is over a 10-year period. However, it's not as straightforward as that, because typically the things that local authorities do change over a period of time. And what we found over the last 10 years is that a number of responsibilities have been passed from central government to local governments, and therefore the things that we need to do has actually increased, and therefore you'd expect, because of that, the revenue that you would need to do those services would also increase to cover additional services that we're being asked to provide. A third factor that would mean that if we did nothing else to provide the same services as we did 5 years ago, the same again in 5 years' time, is that there can still be an increase in demand. So, for example, an area that local authorities up and down the country are facing is a huge increase in demand in terms of adult social care. The UK has an ageing population, which on the one hand is a very good thing, because it means people are living longer lives, but it means we have a high proportion of people in our country who will need care in their older years because they're no longer able to look after themselves and need help, typically coming from local authorities or from the NHS. And there's a cost to that. And because there's an increase in demand there, in expect over a 10-year period, if that demand increases, the money that local authorities need to provide that care should increase. So simply, in simple terms, over a 10-year period, you'd expect if we make no change to the services we provide, that our revenue budget would increase. And what that chart shows is that is not what has happened. In a 10-year period, the amount of money that we have to spend on an annual basis for the services we provide is actually decreased. And therefore, quite clearly, we cannot provide all the services, either in their entirety or to the level that we provided before, and that amount of money continues to decrease in the 5 years coming. The second point on that slide is the balance of where the money's come from has changed. And I think many people may not be particularly aware of this. In simple terms, the blue segments of those circles, the blue part is council tax, it's money that we pay to the local authority every year. We pay it. The green part is money that we get from government in the form of grants. It's very complicated where all that money comes from. Essentially, we get lots of money from government for different purposes. Some of it's targeted, some of it's not. And in 2010-11, you can see the proportions, just under a third of it was raised by council tax, and 2/3 of it came from grants from government. And you'll see by the end of financial year 2019-20, that balance has changed completely. The majority of council funding in 5 years' time will come from council tax and not grants from government, and it's a subtle change that's happened that not everybody is particularly aware of. But it is important because I think people need to be aware where the money is coming from in terms of the services that we provide to residents from the council. The second thing that I wanted to briefly look at is what Cabinet has done this year to put the draft proposals forward for consultation. It was quite clear last year that this local authority was getting to the point where, in terms of the revenue that it had from council tax and grants from government, the amount of money that we had to spend annually for services that we provide was getting to the point where we could provide no more than the statutory services. And then everything else, all the non-statutory services, it was beginning to look like we just could not afford any of them. And therefore, that's quite a difficult place to be in. We had to be quite clear about what we could afford, what we had to provide services. So what we set about doing initially was actually looking at all the services we provide and dividing them into 3 sections. The first section is the services that we have to provide by statute, things that in law say you've got to do X, Y, and Z, and we've got no choice about it, we have to go and deliver it. And clearly we must continue to provide those services in some form. You would think that's a straightforward exercise, but it's not. As the slide shows, there's some 1,300 pieces of legislation that the local authorities have to follow in terms of describing what we should do. That's a complex task in itself, but it's further complicated by the fact that, as you can imagine, in English law, the legislation is never particularly clear about what a service has to be. It will say you have to provide this particular service, but it's often open to interpretation as to what level of service you provide that fulfills the requirement of that act. So there's always a judgment about, do we need to spend more to fulfill the law, and we spend less? And local authorities will make different judgments on that legislation, but down the country. But nonetheless, we went through, when we came up with what we called our core budget offer of things that we have to statutorily provide to satisfy the law. Added into that, as the core budget offer, are also things that we will continue to do because they make economic sense. So, for example, I always use is car parks. We, as a local authority, don't have to provide car parks. But clearly when we do provide car parks, it brings in a revenue because we charge for car parking. It makes a small amount of profit, and the money that we get from that we can then use in the highways budget. So it makes financial sense to provide car parks because we gain financial benefit and we can provide services for the local authority. There's a whole bunch of things that we do that fall in that camp. And they're included in that core budget because it would make no sense not to continue doing them because they either break even or they raise a small amount of revenue for us. The cost of doing those services and the things that we must do, the statutory services, comes out to around £87 million in today's prices as an annual revenue budget. And to give you some idea of what flexibility there is in that, in terms of how much we must spend on social care from that budget, £54 million of our money, your money, is spent on social care, and that includes vulnerable children, about 2/3 of that budget is spent on social care. And the remaining portion is spent on all the other statutory services that we have to provide. So we looked at that and said these are things we either must do or makes financial sense to do. And then we looked at what was up remaining all the non-statutory services and put the cost of what it would cost to run those services that we did in the last year. And the cost of those services are around £12.5 million. Some of those services are things that you'd expect are non-statutory. Leisure predominantly is a non-statutory service, but there are also things in there that people might be a bit surprised are not statutory. Things like school crossing patrols. Local authorities don't have to provide school crossing patrols. It's a non-statutory service, but it's probably a service that the majority of people think, well, actually, it would be rather daft not to do it because of issues around children getting safe to school. And the point I make is that you might sometimes think that we'll just do away with all non-statutory stuff because you don't have to do them. But in reality, most of the things that are non-statutory are the things that people like to have, and all the things that are non-statutory we must do. In a sense, life insurance for things like adult social care, for things that you really don't want to have to personally have to use. But if it comes to it and you need those services, frankly, you do want the council to step in and say, well, actually, we can support you. And it produces a great difficulty about making choice about which things we don't have to do, but we include in our offer. Clearly, we have to fund anything that we do. I said that the cost that of the all statutory stuff is around £87 million. The money that we then have left to fund the non-statutory services is essentially coming from two sources. Firstly, we have an element of revenue balances, money that we haven't spent in previous years that are available to spend to help the budgets going forward. We can use that to fund some of the non-statutory services. And the second thing that the local authority is doing, as have a number of other local authorities in the country, is change the way that we are paying the debt for borrowing we didn't use for capital projects. We've reduced the rate at which we're paying that debt, which means we have another income stream that we can then use as revenue to fund the non-statutory services. The money that we've got available for that, from those two sources, comes to around £2.5 million per annum. And I said that we need £12.5 million to provide all the non-statutory services, so clearly there's yet another, again, a huge gap of around £10 million. And we somehow have to deal with that, and being blunt about it, it means we have to cut further services again over the next December medium-term financial plan. So further £10 million has to be cut from the services that we provide. And clearly, those cuts have to fall on the services that are not statutory. We've called that £2.5 million the Futures Fund, and when we were presenting the proposals, the criteria that we used, I won't go through them all, but they're listed on there in terms of reasons that we would say we should provide a particular service as opposed to not provide another service. And it's around, does it fulfil some of those criteria? And if it does, it's something that we should suggest as part of the budget proposals. We should include something that we continue to provide as a service. Now, clearly, we need £12.5 million to do all the things that are non-statutory. And I'm not going to deny that some of the things that we're saying in the proposals that we're not going to do probably do fulfil some of those criteria. So it has very much come down to judgment about what we think is best, what we think residents of Darlington would prefer to have when we've got to make choices about stopping certain services or reducing those services. And that's really what the discussion about the budget is about this year, and also what tonight's event is about.
I'm Veronica Copeland, I'm the cabinet member for adult social care and housing. So I'm really going to talk about adult social care tonight because, as most people know, the housing revenue account is a ring-fenced account. So that's already been through the cabinet and council. Right, I'll call off and just briefly go through what social services provides. And it's quite a long list because some eagle-eyed people have realised it is the largest part of the council's budget. Spend about 32 million on adult social care, and the remainder of that 54 million goes on children's social care services. So In adults, we have a lot of statutory obligations, and that's what most of our money is spent on. And they are all combined together in a new act called the Care Act, which was passed in 2014. So we have social care staffing, of course our social workers, care staff, liaison officers, occupational therapists, etc. They carry out the assessment of need for people who come to social services looking for some help and support. And in some cases, the liaison officers work directly with people to try and make them as independent as possible. Our other social care commitments are listed there. Caring for homeless people, looking to find them accommodation, offering them support to maintain that accommodation once they've been found somewhere suitable. The housing option services, which acts to get the right property for people. Support for vulnerable parents and families. These are where vulnerable adults, they may be people who have mental health issues, etc. And try and give them support to make sure that they can look after their children properly. There's a lot of synergy between adult social care and children's. We do work together. The care repair, that is what we call the overarching area that looks after our disabilities facility grant, where we pay for adaptations to keep people, again, independent within their own properties and try and prevent them from having to go into care. Our social workers offer mental health support, work with the community psychiatric nurses to support those who have mental health issues to live independently within the community, make sure they get the right treatment and that they take their medication, etc. Learning disabilities, again, we provide support to help people with a learning disability to live as independent a life as possible within the community. Our social workers carry out assessments and offer packages of care for people with disabilities and of course for our elderly residents, and also help them if they deteriorate and need to go into residential care. They will do the assessment to help them find an appropriate place. Obviously, increased pressures in this area as we have more and more people living longer, which is to be welcomed, but with increased age does come increased disabilities and ill health, and we do need to support these people. Next slide, please. In order to support our social workers and their assessments, we do have a team behind that do the financial assessments. Health is provided free at the point of delivery, but social care is financially assessed, and many people do make some contribution towards their social care. And also this team look after people's finances who are no longer capable of doing that, and make sure that their money is kept safe and we don't have any abuse of their finances. We also provide direct payments to people where they get a package of care. They can have the direct payment and sort out how they want their care to be provided. So we have a team who ensure that the payments are made and the money is put in separate bank accounts, and that is spent on the necessary care for people. We have a team that does the commissioning and looks after the contracts and does the quality monitoring for us. Obviously, if we have contracts with residential care, we want to make sure that those homes are providing a good quality service to our elderly people. The same with domiciliary care. We do a certain amount of workforce development because there is a statutory training that our social workers must undertake in order to keep their professional development and keep up to speed with any changes in the law, etc. So that is provided for staff. And we have performance and project management that covers children's, adults and public health that make sure that projects are delivered on time and within cost. And also the main services that we provide. anything where we can reduce costs on commissioning, contract and quality monitoring. We want to avoid duplication. We are aware that other agencies do some of this. The Care Quality Commission is one of them. So we want, if we can make savings by avoiding duplication and liaising better with the other agencies, then we will do that. Looking at alternative methods of meeting the assessments of clients, this is the packages of care. Looking at better use of technology. I'm sure a lot of people have heard of telehealth and telecare, and also we can get electronic pharmacy boxes now that will let people know that members of the public have taken their medication when they should do, and helps them keep track that they have taken it at the correct time. Other reductions that we are going to have to make, because they're not statutory, this is a part of the discretionary element, is reducing some of our housing-related support aimed at supporting vulnerable people to live more independently within the community and avoid becoming homeless. This is some of our preventative services which we have developed over a number of years and worked with the voluntary sector to develop this. Unfortunately, they're not statutory, and we're going to make quite a lot of cuts in this area. And they are listed there. Domestic abuse, we're going to reduce the floating support that we offer there. We will still be having our refuge in Darlington. Vulnerable adults over 25, this is often people with mental health issues, could be ex-offenders. We are going to have to reduce the support we offer them. And vulnerable adults with substance misuse, that's another group that we offer support to. And young people up to age 25, some of these are care leavers, and some of them are young people who the government often think they can live with their parents, but there's often been breakdowns there and they're no longer able to stay with their parents, and they're out on the street. However, we, as you can see, we are putting some money aside out of the Futures Fund, £160,000, which we will use to still offer some help in those areas, which obviously will be a much reduced service. I've also heard that there is some money left in the DAT, and we hope to use that to support some of those young people who are suffering the effects of drug and alcohol problems, because that obviously is a big area of concern. Designated housing-related support funding for the key point of access will end that, but we will still be able to offer that through Darlington Borough Council. So that's really his first stop that's going to be affected. But we will still have a similar service actually run by the council, and DBC will continue to provide that housing option service. A few small grants there that we are going to cease, which is the Aspire service, which is for young people with disabilities when they leave school. We try to put some extra support in there to help them find work. But I understand, that service is offered by other charities, and also the college does offer some support there. We're starting the grant to GAD, the DAD information course, which we've been funding, and we did pay rent for a room hire for the deaf children, and we'll be ceasing that.
Okay, as I said, I'm going to Cindy's, then I'm going to ask Andy to do this section. I'm going to stop because that kind of is one module, social care, community support, then take questions and answers on that. Then move on to Cindy, which is separate entity. Otherwise, I'm conscious you've been sat there for a long time and just been talked about, which is not fun. Core services for children's services, social work and independent review, social work speaks for itself, child protection, supporting families where perhaps the adults and parents do not have identified needs that adult services will provide for them, but it would still be beneficial to receive some kind of social work support. core group care plans, ensuring that children that are on the child protection register are monitored, visited and the parents worked with. The independent review, we've got independent reviewing officers who chair review conferences to ensure that whatever recommendations were made by initial case conferences are actually being acted on. Looked after children, reasonably good split into a number of subgroups. Children that are fostered by us, children that are fostered privately, we have responsibility for private fostering in certain circumstances, and adoption, although we use adoption agencies, we still have an obligation to ensure that where possible, where necessary, children are adopted, and support to Darlington who may adopt in to the town. I have personal experience of that service. Disabled children, again, kind of speaks for itself. It's about those children who progressively have been born with or have developed some kind of a disability. Respite facilities at Airwood Lodge, which parents really value, but are not cheap to run. But obviously we, as a civilised society, we endeavour to do that. The early help model will continue in some shape or form, but we're not yet sure what. We're still in negotiations with health as to exactly how that will look, but it's fair to say that it will not be the same level of funding. Youth vending service will be reduced. It will continue because it's a statutory obligation. Somebody said, I'd heard on the radio or TV, that in the budget this afternoon the Chancellor has reduced more money to the Ministry of Justice. If that is true, that may well impact on that. So whatever we say we're offering here, we may not be able to. I'm conscious that somebody will take the view, well, just lock it up. It doesn't work. The reality is that for every pound we spend on youth justice, we save people becoming victims down the line, and it is incredibly cost effective, and we have an incredibly successful youth offending service, but we will have to reduce back. Education, early years, school improvement, obviously we still have responsibilities for that, although most of our schools are now academies, and I suspect long before today's announcement comes into effect, the individual schools will become academies as well, but we still retain responsibility obviously for early years. Under certain circumstances, education, school transport, or the limit which is agreed by the authority, we will transport young people to schools. Safeguarding partnership and management boards for both adults and children. They're both statutory bodies. They both have independent chairs and members appointed in the local authority's responsibility to ensure that they function. It is their responsibility to ensure that the social services department of adults and children comply with both regulation, legislation and care plans. They're also charged with carrying out serious case reviews should something regrettably go wrong.